Sorry, ma'am, for the delay. And I know you're running between schedules, and thank you so much for taking time amid such a hectic schedule and a travel plan tomorrow. Thank you so much once again. And I would like to just say a few words before inviting Dr. Suchitra Elagaru for a few lines for soil students. We're talking about the problem solving, the global problem solving, and everyone, every single human being on this planet, the last 2 years, or 2.5 years to that matter, we all had one common emotion: fear. Fear of coming out, fear of touching people, fear of talking to people, fear of traveling, fear of doing business. It's a common emotion, like the fear that spread across the world. And that's the basic human thing. The basic human emotion is like, we have to go and talk to a human. And this problem was solved within 9 months by the competency that Dr. Krishna Elagaru and Dr. Suchitra, and of course the Bharat Biotech team has established over the last 2.5 decades. And thank you so much, ma'am. Today we are talking about restoring the world, restoring the GDP and everything. So as per the Puranas, whenever there is such kind of a world issue, I know this, I'm not exaggerating. This is where, every time we get the Avatara Purusha into picture, maybe 100 years or 200 years down the lane, somebody would definitely, take these kind of stories from your life as, the 10th or the 11th Avatar, which saved the entire world. And thanks for being here. Your words will be very precious for this generation and the upcoming generations.
The name is Krishna.
Krishna. Right? So, please, ma'am, on these lines, I want you to.
Oh, wow. That's, Shrikant, that's very heavy. Don't take us to such levels, because I think we are mere mortals. I have had the, I don't know, I have mixed feelings here. I told Usha that I would do this. She asked me she's been behind me since March, April, I think. And I've been telling her yes, yes, yes. And then there was some travel that came up last month. We had to be out of the country. We couldn't do it. So again, I told her, June, July, whenever it's there, let me know, I'll be there. And thank God, I'm traveling tomorrow, and I'm very happy that this program is being done here today, and I'm able to be a part of it. And when I came here, I was thinking, before coming here, I know Jay is a part of this. Jay is not only a dear friend, but he's a role model to all of us techies. Though I'm not from the Silicon Valley, I also claim to be a techie. He has done things for the state, for the region, for the country that I think many should emulate from. When Krishna and I came back to India in the mid-90s, again, people like Jay from the IT world, many others, Mohan Reddy, a dear friend again, Dr. Anji Reddy from the life sciences, all of them have, started bringing technology and innovation as a part of their story to tell to the, to the society around them. It was not about being wealthy for generations and things like that. So I think maybe this was something that drove, these are inspirational stories. Way back in the late 90s. So it was probably inspirational for us at that point of time, coming back from the US, to look up and say, hey, look, maybe we could also try give it a shot. We don't know what the end of the tunnel is going to be when we are at the very beginning of the tunnel, because I don't think we can predict it, in spite of all the business expertise we have, the calculations and everything. But I think all these kind of people who have contributed to the ecosystem of building a new India, of building a different India, of showcasing a modern India, a new avatar of Bharat and India. We need both. I'm not trying to get away from one. So I think these were the sons of the soil and the daughters. Kiran, I forgot Kiran, how could I? Kiran Majumdar. I mean, these are all people who have really just sprung from the soil. I think I'm right in saying that. When they just started from scratch, we heard stories of Dr. Anji Reddy, of starting Reddy Laboratories in a small Bolaram, in one of the IDA Bolaram, one of those small sheds. Maybe it was a small industry, small scale to begin with. So these are sons and daughters of the soil. And I think it is our responsibility standing here today, and I thank Usha and Shrikant for doing this. Probably Krishna and I cannot take up such initiatives, but I'm so proud of these two youngsters. I know they came back from the US. I know Usha was in the US. I know Shrikant was in the US. So when I look at these youngsters, I wonder, oh my God, they are, I don't know, 5 times, 10 times more faster, or even more faster than the thought process that we all came back to the times that we had to get him. But for this time, I think we need more Shrikants and more Ushas for this country. I think people like Jay and Subbarangai Garu and Ajit and Bala and all of you will agree with me that we need to create this kind of bandwidth for the future of the next 50 years or the next 75 years for India going forward. Having said that, congratulations to you once again and best wishes. Good luck. Don't give it up. Don't give it up. Keep on innovating. And don't worry about the rest. As Subbarangai Garu just said, get rid of all the don't worry about all the baggage and the dirt and all the other stuff that is outside, because there's lots of distractions. Just focus on what you want to do, what you wish to bring it out and project to the in reality. This can't be on paper, and it's not. It's virtual, I understand, but it has to be seen physically as well. The impact has to be created, and the responsibilities that we all have is not going to end so soon. So continue your job, great work, and good luck. God be with you guys. I don't know how much time Usha and Shrikant have given me. I don't know what I need to talk, because I was just using the word earlier today at the coffee break. I said I'm a little scared of speaking in front of Ajit, Jay, of course, and of course Professor Garu, Subbarangai Garu, who has been a coffee mate of Krishna and me during our morning walks. All are known good friends, very seniors in the industry that we all come from, but people who have really shown and led by their walk. It's like walking your talk. That's important as well going forward. I think that's what we need to create for the younger generation. It's not about what's written in books and what's, we can't show the stars and say, those are the stars, but we need to also, show the way or the resources or the knowledge that we need in order to aim for the stars and reach the stars, in fact. So that is, I think, what children need to be taught going forward. Analytical thinking seems to be more important than our own degrees and certificates and problem solving. And analytical thinking is nothing but problem solving. And also, we don't want to look at the problems of the stars and the moon and what is out there that we can't touch and reach and feel, but we need to look at problems that are around us, that are just in front of us. I mean, all over the world. It's not necessarily India or any particular part of the world, but I think all over the world. I mean, there's enough challenges out there that I think there's so much opportunities for everyone to give back to the world at large. I think వసుదైవ కుటుంబకం అని మనం చెప్పటం అనేది మన పురాణాలు ఇతిహాసాల గురించి నాకు మాట్లాడటం పెద్దగా రాదు. బట్ ఎందరో మహానుభావులు అందరికీ వందనములు అని చెప్పిన ఒక పెద్ద సంస్కారం మనదన్నమాట. సో ఐ థింక్ దట్ ఈస్ that is what brings the value systems that we as a culture, we in our heritage and in all the past that we learn from, and dharmo rakshati rakshitaha. That is a great saying. As Professor Garu was saying, none of us probably have the time to sit and go and read and understand, not even read, forget about reading, understanding the inner essence of all those Puranas and the itihasas that are there. But these golden words, golden small little sayings, when you just infer them, basic meaning out of it, I think that just talks or will be the walk of life that we need to pursue our careers and our personal lives going forward. Having said this, Bharat has been around for the last 25 odd years in the city of Hyderabad. Jay probably knows us more than of late. We don't get to interact as much, but he has seen us go through the journey of being entrepreneurs. Came back to India with a container full of, not money, but a container full of small lab equipments and chemicals and consumables and things like that, and a few other personal belongings that we had accrued over 15 years in the United States. Gave up our permanent residencies and made a decision by choice. It was not default. It was a decision that was made by choice to come back to India and try our hand at what we need to build or what we need to give back to the system from which we have taken so much through our journeys of learning, our teachers and all our mentors who have been there, our parents, our social system. So Bharat was born out of passion for both of us. First generation entrepreneurs, had no clue, had no idea what management school and management gurus like Ajit would talk about in terms of running your company, managing your balance sheet and getting your marketing and putting up your technology and distribution and all, whatnot. I mean, supply chain and things like that. It was just a passion. The seed was sown as, the passion was the seed. And I think once that is done, then everything else just disappears. We just need to be at it, nurturing it, watering it, ensuring that it is not trampled over by some other system that is outside, or for anything for that matter. And Bharat was something that started off like this, very humble, very small, very purposeful, because again we felt that technologies in the health sciences, innovation was not happening. By then we had, though we had many of my dear friends in the pharmaceutical sectors had done enough for the country in terms of manufacturing generic drugs and making them affordable. But again, we also started getting a stamp of being a copycat nation in the technology-driven era that we all now belong to. So that was, there was no more an excuse for saying that India would be a copycat nation and a copycat country. So we wanted to see whether we could bring in technology platforms that could be created, innovated indigenously, built on indigenously, developed indigenously, manufactured indigenously, distributed to the domestic markets, which was a huge percent of our market share that we have even today. servicing India is probably the biggest management lesson that Krishna and I could have ever learned in our entire career span of 40 years now. So we ensured that we would not give up. We wanted to make sure that the first product came out. Credibility had to be maintained because there were no takers for Indian technology and Indian science and academic expertise was also looked at as, something that was not relevant for the industry or for the commercial world. So that also had to be, had to be flipped around and conveyed to the world that no, this is a deep science-driven, technology-driven kind of a model that we need to take up in public health and vaccines and life sciences. Whatever you call it today is all under the gamut of value creation is in commercial terms, but it is innovation, it is new ideas, and also building intellectual property rights for our own country for the future. Bharat's journey has not been easy. It has been tough. Like I said, being first-generation entrepreneurs has given us enough pricks, more than, the failures were probably more. We could count on more failures than we could count on our successes. But nevertheless, each one of those failures taught us to be resilient and to go forward and not to give up and not to go backward. I could have packed my bags within 4 years or 5 years because the first revenue model came after 3 years of coming to India. So there was not a revenue model for us until the first 3 years. So that was how difficult it was to sustain a startup in those days when we didn't have the funding that we have today, what our youngsters are capable of getting for their ideas and for their new projects and new ideas that they have. So this was then, but what is important is people like Dr. Kalam have always ignited that kind of, again, the passion of science is ignited by many, many of them. Dr. Mashelkar is a great example of how he would drive all of us in the area of life sciences to think forward. Dr. Maharaj Kishan Ban, a pediatrician from the All India Institute of Medical Sciences, who isolated the strain of the rotavirus vaccine that we developed in India after 18 years of clinical research and development, and making India the third country in the world to develop and manufacture and market a rotavirus vaccine. So these are people who have laid, the foundation, I would say. Dr. Kalam came and told us in one of his visits, he said, Krishna, I have a 3-vaccine dream for India. And I quote, he said, India should make hepatitis B, HIV, and malaria. I unquote. This is something that he just sowed in us 25 years ago, 22 years ago maybe. And it still remains fresh in our minds, in our thought processes every day when I come to work, when I enter my gates, when I go to my office or Krishna comes in. This is what drives us. It's just the kind of motivation and the kind of strength that each and every one of them have turned around and passed it on to people like us who could maybe try and take it forward. Again, there are no guarantees. So that is how rotavirus came. When we did this, we did it with more than 50, 60 global partners, including Stanford, including the Bill and Melinda Gates Foundation. We had the National Institutes of Health from the United States. We had ourselves, Bharat was the development partner. We had the All India Institute of Medical Sciences. We had the Indian Institute of Science in Bangalore. And of course, the Department of Biotechnology, the Government of India, which was the facilitator. Both the governments facilitated it, the US and the Indian governments. So it was a major, major public-private partnership. Believe me, we did not have $100 million to develop a new vaccine. This came through social funding. It was philanthropy that ultimately came back and helped serve problems for the world, for public health or for humanity. $100 million is not a joke. Even maybe 10 years ago, it's still not a joke, 500 crores, if I'm not wrong. So it was not easy for Indian startup, young, first-generation companies to take up this kind of research, which had to be, again, world-class, because there's no copying involved here. Everything needs to be proven. There's John Hopkins in the picture as well. I mean, you name it. The best of the world, the best from India are sitting with you, and you're trying to make this happen. So you don't give up. You just, go on until you see the light at the end of the tunnel. You don't just give up. And that was when the Honorable Prime Minister launched it in March 2015, when rotavirus could be commercially done. Coming to COVID, we were all buckling under 2020, the pressures from China and the international community. As an organization, we were a little, of course, also thrown aback, because we did have some confidence, or I would say not confidence, before confidence, we did have some experience in handling the H1N1 virus when it hit us about 10, 12 years ago. We did manufacture the swine flu vaccine for the government again, because they had to get the strains from the US, from CDC, and bring the strains to India. And then, because the strains get isolated by these large, international agencies, the CDC or the NIH, or people like that. So we did not have strains in India. So the H1N1 strains came from the United States to the government of India, through the government, and of course was given to us as manufacturers to develop and manufacture it. So we did it. So there was some little bit of competency established. We had a huge viral vaccine program which was out there for us. Rotavirus is an example which I just spoke about. We did Japanese encephalitis before that. So when COVID struck us, we were already working on Zika and chikungunya as potential vaccine candidates. Right now they are undergoing human phase 3 trials, again funded by international and global agencies for large-scale trials across the world. We don't do trials just in India. We have to do it in different populations and groups of ethnicity, so that we have a larger database from around the world to show the efficacy and of the product itself before it gets launched. When COVID was around, then we felt, what are we going to do about this? As a country, we did not have the mRNA technology. The Americans beat us to that, or the Germans did. It's always like that. It's the G7 that controls the entire technologies in the health space. I know Jay knows this, Ajit knows this, everybody. Most of us know this. So it was always Japan, Germany, or UK, or the United States. So we were not up to it. We did not have a lab in this country that is working on the mRNA technology. We still don't have. So this is where we have so many opportunities with the kind of education, with the kind of skill set and the resources that we have collectively, that we can plow in back into this system and to the future generations to create the process of sowing the seeds for innovation that is required. Because when push comes to shove, it is technology that matters. And even for us, it is the same thing. So we said, fine, we don't have that. What do we do next? We manufacture the classical style vaccines. We did rotavirus, which was on different vector platforms. So we said we can try that, and we took the other route and the other approach, because we were very competent, we were very confident by then that we can handle this virus as well. So that is how we wrote to the ICMR, and we requested them again, because this is now a public health problem. Everybody was shuddering and locked in their rooms and offices and whatnot. So we wrote to the Government of India, to the ICMR, asking for them to give us samples of the SARS-CoV-2 virus strains, because the center is in NIV, this is Pune, and they are the National Center for Virology. And we cannot go to the street or go to a hospital in Hyderabad and say, hey, look, I need your blood samples and I need to isolate the strain from a patient who had already got the infection by then. So we wanted it to be very authenticated and also very legitimate, that we source the strains from the national authorities. And NIV was the institution for that. So we got the strains from NIV. And then we brought it here by road. People would ask, why is she talking all these things? If there are no challenges, then there are no opportunities. I think look at a challenge and see how you can convert it into an opportunity. The challenge was that there was no air cargo flying in this country. There was no airline. There was no logistics provider. Our own half a dozen logistics service providers who are all lined up with us carrying millions of doses of our vaccine in -20. Nobody is there. There's not a single cold truck in the country. There's not a driver. There is not a cold truck. So what do? Krishna and I were getting ready to go to Pune, to drive by road, to reach NIV and collect the virus samples and bring it back into Hyderabad. Because it would be unfair on our part to make our employees or someone else down the line do it. But then they came back around and said, Mrs. Ella and Dr. Ella, you guys please stay here. We want you to be at the control room. We would go and bring the virus back. 4 of our senior most colleagues in bioprocesses drove to Pune without food, without water, without a chai shop on the way. You know how this roads. We were locked down 1.0. This was April end. And 4 of my senior most colleagues drove to Pune, brought the virus strains back right in the back of their car in a -70 container. That is how the strains reached Bharat Biotech. I only say this because it is not Krishna Ella and Suchitra Ella. I'm just, we happen to be the face of the organization, or the names that get, pulled up very often by dear friends like Ajit and Jay. This is the entire commitment, teamwork of the 3,000 odd employees at Bharat. Because nobody ever came up and said to we had a control room because we were all in lockdown. And on May 1st, we said we need permissions to go into the plants, this is Shamirpet. So, of course, our police and the Cyberabad Commissionerate, they were all very helpful. They gave us all our car passes, and all our vehicles were all social distanced, and all our buses doubled itself because of the numbers that we have to commute, and we were all essential services. The life sciences industry was working full-time, around the clock, and we spread out the operations so thin that there were not more than 400 people on campus at any point of time. So when we stayed back, these 4 gentlemen drove to Pune, collected the samples, brought it back. Another 40 to 50 of the bioprocess engineers walked in with the virus, knowing that they're handling a deadly virus. They're carrying it, walked into the facilities, the BSL-3 containment facilities, and contained the virus, grew the virus in thousands of liters now. What came in micrograms had to now been grown in thousands of liters in the fermenters. And of course, deactivating it, killing it, and then formulating it, and then making a vaccine. We had the vaccine candidate made in less than 45 days. That was not the issue. But how do we scientifically prove it? See, technology cannot be just said and we cannot walk away from it. We need to, that's why I said we need to walk the talk. So we need to prove it scientifically. We need to validate it scientifically. The academic world is going to question us as to what we are getting into. So we need to be ready for that kind of flack, criticism, whatever you call it. It doesn't matter. Questioning, which is good actually. And also we need to tell the world what we are doing, because the world is not going to then say, oh no, these guys did some jugaad, which we are also known for at times. So we had to take in all these factors. But the tremendous support that we received was from our own employees who came and said, please, we'll come in and work. Nobody stayed back at home, except where they had issues with their colonies and the associations initially, where people were restricted from moving in and out and things like that. There were certain issues, but otherwise, over and above, almost everybody came to work. And they were rather willing to come to work. And they did not want to sit at home, except if there was somebody at home who was infected. And then we knew that we had to cordon this person off work for 3 weeks, or until they had a better situation at home. So, I mean, all these things don't deter us, because you know what? I think ultimately, as Professor Subrangaya Garu said, if you are fixated on the focus and the end point or the goal that you want to reach at the end of the as far as you can, as your eyesight can see it, you can envision it, I think then everything else doesn't matter. These are mere logistical, physical, ground level issues. The way we were working was 24/7. I don't know if we slept 4 hours a day with good sleep, because I knew Rachis and Jala would be up at 3 in the morning. And, they were saying we were not able to sleep. We are looking at what needs to be done at 9 in the morning at work, because we were all commuting 150 kilometers every day to Shamirpet. So this was how this entire group of people, right from the board at the level of me and Krishna, we were all in office. Our entire teams pulled it through. There was consistency in what we did. We did the animal trials, and we told the government, because everything is regulated, and here you can come and ask, why did it take you 12 months? Because I had a tough time handling my friends in the media. Why is it taking so long? Is it because Indians are incompetent and you guys don't know what you're doing? Are you just giving us a fast one by saying that you guys are working on a COVID vaccine? If China can do it and Russia can do it, and by then there were about 200 and odd groups in the world that were working on a COVID vaccine program or platforms. So the media would not let us sleep. Even at midnight, there would be calls. So we had to tell them that, look, like I said earlier, proof of concept is important. Safety is important. In vaccine technology, it is safety, safety, and safety. These are the first and the top 3, and that will remain the same forever. It's not about immunogenicity, it is not about efficacy, it is not about potency or anything else. It's safety, safety, safety. The vaccine, it does not have to work, but it should not kill, or it should not hurt, harm, cause injury, or whatever physiological reaction that it should not. So safety was the parameter. So the animals were all fine, and then we come highly regulated by the Drug Controller of India. We are a regulated industry, and the highest office in the country is the Drug Controller General of India, who monitors every little sheet of paper and every piece of equipment that is there, from the QC to the R&D to the animal studies and the human data and everything else, and then the manufacturing and all the other processes that are involved in it. The Ministry of Health, of course. So the testing happens in a lab isolated in Himachal Pradesh. So every batch of vaccine made in Hyderabad, every batch, mind you, this is not a blanket permission. Saying that COVAXIN gets licensed and everything goes out whenever they want and all that. No, every batch of the vaccine gets shipped to Himachal Pradesh. There again, it takes them 8 to 10 weeks to clear a batch of vaccine before it can go into the distribution system. But this time around, the government and everybody, all of them, fast-tracked the scenario for both the manufacturers, both Serum and Bharat, because we knew the challenges that we had in front of us for the country. So we could manage and bring about a fast track and an efficient way of getting the vaccine batches tested, thanks to the government agencies who regulate us and who also worked almost day and night with us. And then we could launch the vaccines for the country, for the first responders in 2021 on Jan 16th. We had goosebumps. The first truck rolled out on Jan 13th, 2021. It was at about 1 a.m. in the morning. About 200 of our colleagues were at the plant. I was watching it. I was there till 10 p.m. in the plant. I came back home and I had my camera was on, and I was just watching the trucks rolling out to the airport, because the first cargo was getting out at 5 in the morning. I had tears down my eyes, rolling down my eyes, thanking God and thanking my entire team. It was teamwork, because like I said again, it's just not me and Krishna doing this. And Krishna is not a Yoga Purush, and I'm not something else either. So it was just that human endeavor, human spirit, and the conviction that we can do it and that we need to do it. And we have to try it. It doesn't matter whether you succeed or you fail. I think ultimately, children have to be taught that failure is okay too. Otherwise, we should not be seeing children taking away their lives just because they lost a few marks or they didn't pass a particular exam. I don't think life is just one exam. Life is thousands of exams, hundreds of exams, or thousands of exams. So I think these are the things that we need to inculcate in our children, not to give up, to think beyond what their eye can see, and to take challenges as opportunities. Sometimes to complain, sometimes not to complain, sometimes to be patient, sometimes to be impatient, but not to let go of passion. And I think that is important. And innovation is important for a country like ours. There's no way we could have vaccinated 90% of our population, which is 1 billion of the adult population times 2, makes it 2 billion doses of vaccine, which no other country in the world has done. I think we need to look at the strengths of the system that we also have in this country. The public healthcare system has its gaps, but the vaccination is something that they are almost experts at it. I'm not saying this because I'm a vaccine manufacturer. I know this because I deal with the system day in and day out. Polio vaccines go out. We all know how many millions of doses of polio vaccines go out twice in a year. That's more than 100 million doses of polio vaccines going out. So everything is in the millions of doses. So there's nothing in hundreds and thousands and in lakhs. Everything is in millions. So I think that experience and the far reach of the ASHA workers and the healthcare system, where they could reach to the remote corners of the villages and the areas that were in the hinterland, could also be done, because this was a 2-to-8 vaccine, which was also easy on the supply chain and on the system. They could handle a 2-to-8. Both the vaccines are 2-to-8, which is like keeping it in your fridge in your home. So that was it. It was not a complicated -20 or a -50 or a 70 kind of a environment that was required for it. So having said all this, we just need to build on the strengths that we have. Like I said, the challenges will become the opportunities for all of us and for the future generation as well. We need to thank our elders for bringing us to where we are today. We are at the 75th year of our independence. I think we should have left, when we leave this world and this country, I think we need to leave it better for the next 75 or 100 years for the future, and give them sow the seeds today so that, or even before, so that they will lead the country forward and take it ahead. And we all wish to see from wherever we are that India should be in the top 3 nations of the world. I think that's my wish and dream. And I think that is only possible not by me or Krishna or Ajit or Jay or all of us sitting here. We are all in the Senior Citizens Club already, or slowly getting there. But I think it's the youngsters of this country, the under 50, the under 40, the under 30, the under 20 that are going to be able to do it. And the under 10, of course. My own grandson is 7. So I think these are the kids that have to be encouraged and motivated, and we need to create the system, the ecosystem for them in order to believe in themselves, believe in their teams, team spirit, believe in the system that is around them, make it better for them if we can, and bring them the right mindset. It's skill set and knowledge set, but I think it's also the right mindset that we need to create in these individuals so that they have to now say that I'm going back to India. I don't have to be in the United States or somewhere else for that matter. Thank you so much for this opportunity. I know I have exceeded my time, but this is like I said, this is passion, and it comes from the heart, as always. It's never a prepared speech, and I like to do it extempore. I think it serves the purpose better. And I have to thank the country and the people of this country who have stood by scientists and academicians and young technologists and professionals and have believed in the competencies that we have created for ourselves here. And I really thank the government and the country and the government of India. It was rather, again, it was like goosebumps. I said, Krishna, this is not happening. When the Padma Bhushan Awards were announced, we were literally shivering and crying in joy. Thanks to the country and thanks to each and every one of you who have stood with us and who have been a great support for us in this journey. Thank you so much. Thank you.
Thank you, ma'am. That was wow. Yes, that was wow, and very heartening. And I think I stand here with much more heavy heart and heavy weight on myself to groom the future leadership that we've started off this journey for. As Ajit sir rightly said, we have to ask the right question. And as Subrangarai Garu rightly said, we have to inculcate what not but ethics into the child. And look at this. You know, I was talking about, are we prepared for the VUCA world? Are you prepared for the VUCA world? No, we are never prepared. Thank you, ma'am, for reiterating it, that it's our commitment and our readiness to be there for, you know, leading the entire generation into a world which is very, very, very uncertain. Thank you. And we stand here with 2 legendary torchbearers who have been there for the economy growth then and now. One, when there was no employment, he brought in the IT revolution. He got all the jobs around. And look at us. We are standing here with so much pride, and we have made the world a single platform. And today, you have brought in the biotechnology revolution with which we are again seeing the world. Thank you. Thank you for giving us this today. I insist that I was very bent on having all you dignitaries and in fact all the SOIL team members. We wanted all you dignitaries to be here today to give the young people around us the need of the hour, you know, what it takes. I don't think you have slept in days. I don't think he has slept in days. You've never given up. You know, you have been relentlessly. The reason you're here today is that you want to still give and stand up for the cause you believe in. I want every generation that is sitting here, every person that is sitting here to understand that it is not what we have, but it is where we want to be, right? So, thank you everyone for making it today and making this a very proud moment for all of us at Soil and believing in everything Soil is doing. We are trying to inculcate to ask the right questions, to build things with ethics, and to be the leadership, the thought leadership that the VUCA world will need forward. Thank you. Shikant.
Thank you so much, ma'am. And Jay sir, I got this inspiration from seeing you for long term and of course, Sajjana Sangatyam, as you say, sir. So there was a time, 20th century was all about E Desamegina, Indu Kalidina, Pogadara ni Talli Bhumi Bharatani, because we were going out for opportunities. I think you've started that, that reverse process. E Desamegara, Indu Kalidara, Pogadara na Talli Bhumi Bharatani. We will take it forward now, we promise you. Thank you. A small felicitation, sir. Just please request you to be on stage, please.
Sorry. I was very emotional when she was talking about the journey, Bharat Biotech, how the vaccines came, and how we are all living in this peaceful world. The commitment from the team, Bharat Biotech team. I think this is what India can do. This is what all of you can do. I think just follow this model. Thank you, ma'am, for your excellent speech.
It is so coincidental that just yesterday the clinical trials which we did in humans and adults and all that is fine, but the 2 to 18 age group, the children's group, 2 to 18 age group, the clinical trials were peer-reviewed and published by Lancet. I don't want to talk about Lancet now, but almost I think any Nobel laureate or a great academician from the Western world gets his or her work published in the Lancet for outstanding quality of work. I think our Indian scientists and our younger generation and the young life science graduates of this country have also proven to the world, the medical fraternity of India has contributed so much to it as well. So it puts Indian science ahead. It is not putting Bharat Biotech ahead, but it is putting Indian science ahead. I think it's putting India ahead and what we can create for the world, the pharmacy of the world that we are being always talked about. It is a reality. It can be done. And we just need to push it and take it forward believe in ourselves and take it forward and do the right things, of course. Keep doing the right things. It was just something that I thought I should share. Thank you so much. And it's the same COVAXIN. There is no difference in it. People keep asking me, is it different? I gave my grandmother, can I give my child the same thing? It's the same COVAXIN. There is no difference in it. And thank you so much.